Joining us now, Dr. Tim Iveson. He is consultant medical oncologist at Southamptom University Hospital NHS Foundation in England and the investigator in the Rilotumumab study. Doctor, thanks for being with us.
Thank you very much.
What can you tell us about the objective of this study?
The objective of this study was to look at the effect of Rilotumumab in combination with the fairly standard chemotherapy regimen of ECX, which is epirubicin, cisplatin and capecitabine, in patients with locally advanced or metastatic gastric cancer. And it was a 3-arm trial, 121 patients in total. A third of them received ECX plus placebo, and the other 2/3 received ECX with one of 2 doses of Rilotumumab. And previously, the initial sort of clinical data in terms of progression-free survival and overall survival has been presented, but today at ASCO I've been presenting the exploratory analysis of biomarkers which were measured also in the study.
And what would you be presenting here?
I'm going to be presenting that by the use of biomarkers, in particular looking at the expression of MET in the tumour, it appears that high expression of MET predicts for a poor prognosis in patients who are just having chemotherapy by itself. So the patients in the placebo arm who received obviously just chemotherapy, their median survival was very poor at 5.7 months. But if you look at those high MET patients who had Rilotumumab, their median survival was 11.1 months. So there's really quite a remarkable increase from 5.7 to 11.1 months.
So what do you think the clinical implications are of this?
I think there are 2 clinical implications. By defining a group of patients who have high MET, then you can probably define a group of patients who have poor prognosis, so it's a prognostic factor. But also, it's a predictive factor in that you can predict that they will then gain benefit from use of a drug targeting the MET pathway, such as Rilotumumab.
So what do you do next with this line of research?
Well, this is really preliminary data because the numbers are small. So the next step is a large phase 3 study investigating the effect of Rilotumumab in gastric cancer patients who have a high MET expression.
And when would you start that?
Hopefully that will start towards the end of this year, beginning of next year.
Okay. Best of luck to you, Doctor. Thanks for joining us.
Thank you very much.
Tim Iveson, he is the investigator in the Rilotumumab study, joining us here at ASCO 2012.